All right, chapter 22, training for female athletes, children, special populations, and masters athletes. And masters athletes, they're referring to older individuals. All right, important factors to women. Responses to exercise for women are going to be similar to men. One of the big differences, though, is going to be impaired thermoregulation during the luteal phase of the menstrual cycle. All right, their core temperature is actually going to increase a little bit, and it's going to increase at least a half of degrees Celsius. All right, which is quite a bit. In fact, this is one of the reasons why a lot of times in environmental research, when you're looking at core temperature, it's really tough to do um, research on women because of this. And in fact, if research protocol is done on women in terms of their core body temperature, it needs to be taken at the exact same times, for each trial if there's multiple trials. So just to try to keep it constant. Some concerns that we'll look at: exercise and menstrual cycle, eating disorders, bone density or osteoporosis, and then also exercise during pregnancy. And we looked a little bit at that in chapter 17. All right, exercise and the menstrual cycles. All right, amenorrhea is usually defined as three or more missed menstrual cycles. All right, but overall, it's a cessation of menstruation. All right, you're skipping some of the menstrual cycles. A lot of times there's athletic amenorrhea where an athlete who is performing a high intensity exercise, that female will actually skip some menstrual cycles, and it's due to the exercise itself. So some possible causes then are going to be the total amount of training, psychological stress that's being placed on the individual. There's actually going to be an increase in catecholamines, epinephrine, norepinephrine, and also opiates that alter the reproductive system in the regulation of the reproductive system also. So that physiological stress releases chemicals that alters the regulation of the reproductive system. Also, body composition can play a role as well. And in fact, going back to the amount of training, exercise causes changes in the hormones and the concentration in the blood. And there's going to be a feedback to the hypothalamus to release the sex hormones. And exercise can cause fluctuations in the hormones that feed back to the hypothalamus. So therefore, there's going to be a fluctuation in the hormones that are released, for the sex hormones or the response to release the sex hormones. So exercise can greatly affect reproductive health as well. I mean, it's still beneficial, but keep in mind that menstrual cycles could be affected by exercise, especially high intensity exercise that's done a lot most days of the week. And in fact, if you look at the figure here that is in the book, um, as a female increases her weekly training distance in terms of miles, there's a huge increase in the incidence of amenorrhea. One thing though, there's no reason to limit training during menstruation. It doesn't seem to be have any effect on exercise performance or health as well. All right, let's look at eating disorders. They do affect both men and women. However, it is more common in females, especially younger females, adolescent females, especially teenagers. Approximately 50% of elite athletes tend to have some type of eating disorder. Now, the two most common ones are going to be anorexia and bulimia. So, anorexia nervosa is essentially starving themselves. There's extreme steps to lose weight. This could be just not eating, taking a lot of laxatives, a lot of antidiuretics. All right, there's going to be obviously starvation that occurs. Excess exercise, along with starvation, is hypergymnasia. So there's going to be a lot of weight loss. All right, and it's not all going to be good, you know, fat mass loss. There's going to be some loss to the fat-free mass as well because you're not maintaining the caloric balance and the right nutrients to maintain fat-free mass. So they actually develop amenorrhea. There's a lot of hormone shifts that occur, thus affecting the reproductive system, and death could occur as well. They become extremely malnourished. For bulimia nervosa, this is binging and purging. So you eat a bunch of food and then they throw it up afterward. And this can cause damage to the teeth and also the esophagus because that stomach acid, that hydrochloric acid coming up with the food through the esophagus and out the mouth, cause damage to the teeth and the esophagus. So it tends to erode the enamel in the teeth, affects the lining of the esophagus as well. So warning signs of anorexia nervosa. Obviously, you're going to have rapid weight loss. They're going to lose it fairly quickly. Could be some mood swings. Again, this is related to the stress that they're under. A lot of times there's some psychological stress that goes along with these eating disorders, but also hormone fluctuations as well. They try to avoid food related activities such as dining out with friends or maybe family reunions. They exercise kind of excessively, multiple times per day, long duration, high intensity exercise. They're preoccupied with food, calories, and weight. It's kind of their almost their livelihood. They think about it all the time, and also they tend to wear baggy clothing just to a couple of different reasons why they could wear baggy clothing is that they could almost be putting a facade on themselves, saying that I'm not underweight, I'm not losing a lot of weight, so they wear the baggy clothes to make themselves look bigger. But also they could make by making themselves look bigger, it could every time they look in the mirror they could think, well, I'm too big, so they get the sense that they need to continue on the path that they are of not eating and exercising more. So it becomes a vicious cycle. And similarly with bulimia, there's obviously a somewhat of a noticeable weight loss. It tends not to be as dramatic as anorexia, but there is a weight loss. Depressive moods, again, there's psychological stress going on, there's hormonal issues as well. There's strict dieting followed by eating binges. And a lot of times, uh, young females will go back and forth between bulimia and anorexia. All right, they'll, for a while they might be bulimic, and then they go to anorexia. Uh, Again, there's a lot of concern about their weight, their appearance, and they also increase the criticisms of their own body. All right, they criticize themselves constantly. You know, what parts don't look right. Um, it doesn't even have to be about weight. A lot of times, individuals who have the eating disorders will have problems with maybe how they look overall, in terms of their facial features or just overall look. And also, one of the signs is there's a lot of bathroom visits after the meals, and this is where they're eating the food and then they're going and throwing it up. All right, some bone mineral disorders. So, osteoporosis is the big thing here. There's a loss of bone mineral density. And the causes that we seen during one of them we seen during chapter 17 was the estrogen deficiency. All right, but in this case, at least in younger individuals or um, females who are exercising a lot of times that's to do with the amenorrhea that causes the decrease in estrogen, which then causes a decrease in the calcium um, that is given to the bones in building bone density. There's also a decrease in calcium intake due to the eating disorders that could possibly be be happening. So then we get this condition, all right, where we have these three um, problems occurring. So we have uh, an eating disorder. So we have a low energy intake. We have amenorrhea, and we also have bone mineral loss. This is known as the female triad. All right, and I'll go ahead and type it in here. That way you kind of see it. Female triad. All right, so those three um, disorders, all right, causing this phenomena. All right, so some type of eating disorder, whether it be bulimia or anorexia, and then they're amenorrheic, all right, because of either the excessive exercise or low nutrients that they're getting, and that then is going to cause bone mineral loss. So the female triad. Also, knee injuries in female athletes tend to be a little bit higher risk for ACL injuries. Now, some possible causes of this fluctuations in hormones during menstrual cycle could possibly affect the structure of the ligaments, the ACL in particular. Therefore, the strength in the proprioception is decreased. However, there's really no direct evidence. This is kind of one of those theoretical approaches here. So, also the knee anatomy itself. Women tend their joints, for the most part, tend to be maybe a little more lax, have greater laxity. All right, they're a little more flexible. But again, there's no direct evidence with this. The big one, though, that probably is the case and is the main reason why there's an increased risk for injuries in female athletes. Is could be an imbalanced strength or proprioception combined with landing biomechanics, and then also joint angles. So because of the joint angles, because women tend to have they do have wider hips, the angle that their femur uh, is going to be pointing downward is going to be greater than it is or actually going to be less than it is for men. They're going to be more inward. Therefore, there's a greater increase for stress being placed on that joint, the knee joint. And because of the landing biomechanics, how they land, all right, coupled with the joint angle, could actually cause an increase in stress being placed on the knee joint, and thus the ligaments within the knee. All right, sports conditioning for children. This is at least has been a controversial topic, uh, but I'm going to just say overall, conditioning, whether it be aerobic or anaerobic or resistance training for younger individuals, prepubescent, is still just as beneficial uh, as for anyone else. All right, they can partake in weight training activities just like anyone else. Obviously, there's some special precautions to take into effect or to take into account. But so first off, the cardiopulmonary system. They do improve VO2 max similar to adults, and there's really no risk for any permanent cardiovascular damage. Now, there are certain situations where there's cardiac sudden death in children, but it is really rare. And most of the time, actually every single time, there was some type of underlying condition that they had, that they maybe had a birth defect of their heart or some type of valve um, at birth, and they just never seen it, so there was a sudden cardiac death associated with that. Now, the musculoskeletal system training actually may optimize growth in the youth, all right, males and females. Now, one of the myths that has kind of been dispelled is that it used to be if they weight trained or partaked in any heavy exercise activity that their growth plates or their epiphyseal plates could close. All right, so there's the growth plate on the femur. Um, they actually thought that would actually close, put too much stress on it, especially like or maybe resistance training or certain heavy exercise sports. So children wouldn't uh, wouldn't partake in some of these events because their parents maybe wouldn't allow them. They were too afraid of it, but they're not going to. I mean, the only way that these are going to close is if there's some type of damage there. Maybe they break them. Now that is especially a cause of concern um, with certain sports. But just physical activity and weight training is not going to make them close. So, endurance and strength training shows no signs of adverse effects and can actually decrease the risk for obesity and diabetes. So, obesity a lot of times causing the diabetes, especially if it's type 2. Now, it might not prevent or um, you know might not prevent type 1 diabetes, but at least type 2 diabetes, it can at least um, stop that. However, one thing is proper supervision, making sure the children are safe while they're exercising, whether it be aerobic or anaerobic activities such as weight training, making sure they're using the right form when they're weight training through certain exercises. One other point I did want to make, going back to the closure of the growth plates, is that again, like I said, one of the myths was um, closing of the plates during weight training activities, and that's simply not true. But there is that risk that if you happen to break a bone right where the growth plate is, then the growth plate is gonna stop for the most part, at least that part of it. So certain sports like football, high impact sports, that there's a higher likelihood of fractures and injuries such as that. That could possibly occur, but you know if they're outside climbing trees or riding a bike, you know the um, the risk for injuries is going to be relatively the same. All right, so having children be active all the time is more beneficial, and really is not anything to worry about, just as long as they take proper precautions, they're supervised. All right, so that's the key there. All right, age-related changes in muscular strength. So sarcopenia. This is a loss of muscle mass due to aging. So again, like I said in chapter 17, we actually decrease the amount of muscle mass while increasing fat mass as well. Our level of activity, physical activity, starts to decrease as we age. So we have a decrease in the muscle fibers, which is the major factor here. So we have an inactivity. The oxidative stress is increased. We have a lot more free radicals. We have inflammation. Testosterone will decrease in both males and females as well. So all these factors play in a role of decreasing our muscle mass, our fat-free mass. Exercise can help negate that loss, although we're still we can't beat father time. We're all gonna reduce our aerobic capacities and our muscle mass over time as we get older, but we can slow that process down by exercising, especially with resistance training. All right? And some is better than none. All right. All right. So the figure here, down here in the bottom of the x-axis, we have age, and then looking at muscle mass. So as you can see, up to about age 50, you can maintain relatively decent amount of muscle mass. Then after age 50, that tends to be the area between 45 and 50 is where you start to get a steady decline in muscle mass. All right, in this figure, looking at the relative muscle strength. All right, and these are arbitrary numbers, and looking at the ages. Um, Starting at age 20, we're going to decrease our overall muscular strength. However, if you're trained, you're going to maintain a higher level the whole way throughout. They're all going to decrease fairly, pretty much the same, about the same proportions. But individuals who are more active and are trained are going to still have a higher muscular strength, and this is going to be beneficial. This is huge. This is um, as you get into 70, 80-year old age, um, that could be the difference between being able to play with the grandkids, or maybe do some gardening. Whatever you do, enjoy your retirement years. It's all about quality of life. So all of that physical activity that you did early on in life can affect how you are later on in life and your quality of life. And the other thing to keep in mind is you need to maintain that activity as well. Just don't say, okay, I'm gonna, from 20 to 40, I'm gonna have a high exercise regimen, but then I'm gonna drop off after there. You need to maintain that exercise, and maintain that physical activity, and also a good diet as well. All right, aging and endurance performance. All right, endurance performance and VO2 max declines as we age, and this figure is actually showing 10-kilometer running times. So as we age, our endurance performance and also our VO2 max then is going to obviously be affected, and it shows here in this figure that we continue to rise, and especially after age 50 to 60, there's a sharp increase in the amount of time it took to run that 10K. All right, and then that's both males and females. This one is simply showing VO2 max. All right, and this one is starting at age 45, and it's a steady decline. All right, so the VO2 max is going to decrease over time, and obviously, if we keep up with our physical activity and our training, we can try to negate some of these numbers from dropping way down. All right, but they will decline over time. All right, and like I was just saying, training can help sustain that performance. All right, so if we look at an individual who was trained versus someone who was untrained or sedentary, had a low physical activity throughout the course of their lifespan, especially later on from middle age to elderly or senior citizen. All right, they both declined relatively at the same rate, but the individual who was trained and continued to train was still at a higher VO2 max. And again, this is beneficial. And if you look here, they're at about 20 VO2 max versus 45 VO2 max. All right, that is a huge difference. Especially someone who is 70, 75 years of age. All right, they can perform those daily activities and do some of those things around the house. Just not exercise, but just daily activities around the house, around the yard, and perform them without getting um, too winded, all right, and too tired. All right, here's a figure from the book. Just real quick to go through this. So as we age, our max heart rate decreases. That 220 minus our age obviously decreases. Maximal stroke volume is going to decrease, and then the AVO2 difference is going to decrease as well. Which all three of these then, so we have cardiac output right here, and we have that other part of the Fick equation, the AVO2 difference, causing a decrease in the VO2 max. Now, exercise economy is not going to change. All right, so that's the steady state versus O2 consumption when exercising below lactate threshold. Just know exercise economy and also possibly economy of effort might not change. The lactate threshold, when it's expressed in percentage of VO2 max, it isn't going to change all that much also as we age. All right, even though the lactate threshold might lower absolute value in terms of the percentage of the VO2, it's just going to drop with the VO2. So then this still does cause a decrease in endurance exercise performance though. So the main thing to take away from here is kind of what starts everything rolling here is when we age, we decrease our heart rate, our max heart rate, and our max stroke volume. And going into the Fick equation, that's cardiac output. So our cardiac output max decreases, and along with that AVO2 difference, that is the big factor that causes a decrease in the VO2 max then. So that was chapter 24, or 22, excuse me, training for females, children, special populations, and masters athletes.